Anatomy 32, Chapter 23, the Respiratory System, Topics, Overview of the Respiratory System and the Nose. So, the respiratory system includes, of course, the lungs and the structures that carry air to and from the lungs. And most of these structures are found in the thoracic cavity. Structurally, you have the upper respiratory system. These are the nose, the nasal cavity, the pharynx, basically structures that are easily accessible by anyone. And then the lower respiratory system includes the larynx, the trachea, the bronchi, and of course the lungs. Functionally, the respiratory system can be broken down into the conducting zone. These are the various interconnected tubes that are providing a route for air, so allowing air to enter and leave the body, as it were. And the very end of the conducting zone is the terminal bronchioles. So it goes from the nose and nasal cavity to the terminal bronchioles. Functions in the conducting zone includes receptors for smell, so olfaction is a function of the conducting zone, filtering the inspired air, so as the air comes in, trying to filter out particulates from that air, producing sounds or phonation, so sound production is part of the conducting zone, and also excreting small amounts of water and heat into the air that is being breathed in, so moistening the air and warming it up. The second part of the functional division is the respiratory zone. The respiratory zone is where gas exchange occurs between the air in the lungs and the bloodstream. And the respiratory zone includes the respiratory bronchioles and the alveoli, these tiny microscopic structures found in the lungs. Another function for the respiratory zone is that it can help regulate blood pH. So it turns out how slow or fast you breathe affects the release of carbon dioxide. And if you release more carbon dioxide, then the pH of blood will increase, will become more basic. So breathing in really fast will cause you to release more carbon dioxide from the bloodstream, which would then raise the blood pH. All right, the nose. That lovely structure on the anterior side of the head is composed of bone tissue, bone structures, frontal bone, nasal bone, maxilla, as well as cartilage. It has a cartilaginous framework and some additional connective tissue. Within the bone, within the nose, you have, of course, the nasal cavity. This includes the nasal septum, which is a wall that separates the nasal cavity into a right and left side, made up of the ethmoid bone, the vomer, and the septal cartilage. And then there are additional bones that help form the nasal cavity, including, as already mentioned, nasal bone, frontal bone, ethmoid bone, sphenoid bone, palatine bone, maxilla bone, lacrimal bone, and of course the inferior nasal concha. All right, the opening for the nose is called the external nares. It's the opening that air can go in and out of. The nasal cavity is in the space that is air-filled and lined with a mucous membrane that contains cilia. So it's a membrane that produces mucus and has cilia that can beat to move the mucus. There are three projections that come out of the lateral walls of the nasal cavity on either side. These are called the nasal conchae. There's a superior nasal concha, middle nasal concha, and inferior nasal concha. And then, of course, there is spaces between the conchae, and those grooves or passages are referred to as nasal meatus or meatuses. So you have a superior nasal meatus, a middle nasal meatus, and an inferior nasal meatus. And of course, again, these are on both the right side and the left side. Here's just a coronal or frontal plane showing the nasal cavity. So you can see the very small superior nasal concha, the larger middle nasal concha, and then the inferior nasal concha, the space or air-filled chamber of the nasal cavity, and then, of course, the nasal septum. On the roof of the nasal cavity is the olfactory epithelium. The olfactory epithelium houses the olfactory receptors for the sense of smell. So these sensory neurons are also receptors, and they bind to chemicals in the air and then transmit signals to the brain. At the back of the nasal cavity is another opening leading to the pharynx, and that is the internal nares. So again, there are two internal nares for the right and left sides of the nasal cavity. There are openings within the walls of the nasal cavity that lead to the paranasal sinuses, the frontal sinus, the sphenoid sinus, the ethmoid sinuses, and the maxilla or maxillary sinuses. And then there's also an opening that leads to the nasolacrimal duct. This duct goes to the orbits, or the eye cavities that hold the eyes, and tear fluid travels from the orbits from the eyes down that tube and into the nasal cavity. So tear fluid drains down into the nasal cavity via the nasolacrimal ducts. Functions of the nose. Well, obviously olfaction or smell. We're able to detect chemicals in the air. Resonance, especially the sinuses add a resonance to the sounds we make. There's the filtration of incoming air. The mucus is able to stick to collect, pull out materials, particulates in the air. Warming of the incoming air, just because the body is a little warmer. Moistening of the incoming air from the mucus of the nasal cavity, and conducting air to or from the pharynx. So breathe in, air goes from the outside into the nasal cavity and then to the pharynx. Breathe out, air goes from the pharynx to the nasal cavity and out to the atmosphere. Oral cavity. Oral cavity is not part of the respiratory system. It is considered only part of the digestive system. However, we all know we can breathe in and out of our mouth, so just wanted to mention that. That is it for this part of Chapter 23.